I hope everybody's having a wonderful day. So today, I would like to talk about Chapter 11. We're going to do this in several parts, about fixing your sex hormones. So we've talked about fixing the adrenals, we've talked about fixing the thyroid, and both of those really have to be fixed before you go after the sex hormones. And today I would like to talk about fixing estrogen. Okay? So just to back up a little bit, the physiology, how the body functions. So so estrogen and the other sex hormones are produced by the sex organs, so the gonads, the ovaries in women and the testicles in men, and are also produced in fat cells. Fat cells produce estrogen, as well as in the adrenal gland. So oftentimes, and we're going to talk quite a bit about this transition into menopause or andropause for men, is that when women start to make this transition, the ovaries start to go quiescent. So the ovaries start to go quiet. And that's when the adrenal gland takes over. So if you have strong adrenals, you have strong thyroid, then your transition into menopause is going to be pretty darn smooth, as long as you don't have other things going on. But this is something, if I could tell this to every single 40-year-old woman who's out there who, at 45 or so, you start going into perimenopause or like around menopause, going into menopause around an average of 50, continuing into 55 until some people are done. If I could tell every 40-year-old to get your adrenals and your thyroid optimized, I would. So if you know any 40-year-olds, please share this video with them. So there's that transition, and those are the different parts of the body that produce the sex hormones. So in terms of estrogen, what ends up happening, most women, as they grow up, if they're going to have any sort of premenstrual issues, so issues that are happening before their period or like during their period, a lot of those are estrogen dependent. So the reason why this is because estrogen gets processed by the liver because it's water soluble. Progesterone does not. So there's a natural cycle. So most of the cycle relies on these different waves of estrogen and progesterone. So the first part of the cycle is really estrogen dependent, where you're building up the lining of the uterus. And then the second half of the cycle is more progesterone dependent, where progesterone becomes a little bit higher than the estrogen. And then the progesterone drops precipitously, and then you have a period. So what ends up happening is that if your liver is congested by any of the usual suspects, heavy metals, chemicals, molds, infections, allergies, emotions, EMFs, any of those things will congest the liver, and then the estrogen won't be able to be processed through the liver. You get an estrogen buildup, and then all of a sudden, this ratio, it's supposed to be progesterone higher than estrogen, all of a sudden the estrogen becomes higher than the progesterone. Estrogen is pro-inflammatory, or can be pro-inflammatory, meaning causing inflammation, and the progesterone is anti-inflammatory. So all of a sudden, you get all this inflammation around your menses. And so what this will cause is people will get worsening cramping, they'll get migraines, they'll get fatigue, all of the issues that you can get around your menses are generally caused because of estrogen. So one of the things that I use when people have estrogen excess, or this too much estrogen, is you can either increase the progesterone or you can decrease the estrogen. It's better to decrease the estrogen. So we'll use a number of detoxifying things, herbs, glutathione, Vitex or chasteberry. So things like that will decrease the estrogen out of the body, and that can make a world of difference. The other thing is, surprise, surprise, fixing your adrenals and your thyroid makes a huge difference. I can't even tell you how many people I fixed their thyroid and their premenstrual issues get better. So super important for so many people. And then as women progress, then they approach menopause, and all of a sudden the ovaries stop or decrease their production of estrogen. And what ends up happening, the symptoms that people end up acquiring are hot flashes, they'll get hair loss, they'll get, and pretty much a lot of these are estrogen tissue dependent as well, so certain organs that prefer estrogen or certain muscles, There'll be bladder dysfunction. So oftentimes if you start sneezing and coughing, you'll notice that you'll get some urination. And that's because the tissues on either side of the bladder neck are estrogen dependent. Vaginal dryness, so consequently that will be irritating, but also intercourse will be irritating because of that vaginal dryness. You can have memory issues. Having lower estrogen will increase your risk for having Alzheimer's, heart attack, and stroke. Now, that has to be balanced with an excess of estrogen that can also cause clotting, so there's a lot of nuances to this as well. But those are the main, and then of course sleep. So progesterone helps women fall asleep, estrogen helps them stay asleep. So oftentimes women will say, I was fine, my sleep was great until I hit menopause, and then all of a sudden I couldn't stay asleep. So that's an estrogen issue. If they say I couldn't fall asleep, that's a progesterone issue. If they say both, then that means that's progesterone and estrogen problems. So those are the symptoms of low estrogen. And then the way that we replace that, oftentimes I'll use a product called Feminescence Pro by NHI, which is a maca product. A maca is a South American adaptogenic herb that's grown in stressful conditions. And if it's grown in this way, it boosts estrogen and progesterone. If it's grown in this way, it can help produce more testosterone in the body. So you're not taking any sort of exogenous estrogen. You're basically just modifying what your body is producing and increasing that. So that's a great natural product that I like to use. And then if I need to, I'll use the lowest dose needed of bioidentical estrogen. And this is a whole nother conversation, but we want to always use estrogen in a ratio of estriol, which is the protective estrogen that decreases the risk of heart attacks, heart disease, cancers, in a greater majority than the estradiol, which is more of the active form. So it's usually 80% or so of the estriol, which is 3 hydroxy groups, and estradiol, diol being 2. So that ratio really helps make sure that you're using estrogen appropriately. And this is more for your knowledge around, because this has to be prescribed. So this is your knowledge around that. And I go into more detail in the book, and there is a place that you can get it if you don't have a prescribing physician, but you do have to monitor this very carefully. Every year, you need a vaginal ultrasound to make sure that the uterine lining is not growing and predisposing you to any cancers, and then a urinary hormone test that's going to look at all the ratios of your hormones to make sure that you're not being predisposed to any sort of female cancers as well. But I tell you, it can be a lifesaver. I probably get more thank you notes from women whose hormones I've fixed than people with fatigue, because it just makes such a huge difference in the quality of life for these people. So we talked about estrogen, how it works. Weight gain. So estrogen, fat cells actually produce estrogen in the body. And so sometimes if you don't have enough estrogen, the body will put on weight. This is why around menopause, women also put on weight. The body will put on weight so that the fat cells will produce estrogen. So when women start taking estrogen, and we never want to take it orally, we always want to take it in a cream, and I'll go into more detail on that at another time. But once they start taking that estrogen, that's where that makes such a huge difference. So we talked about estrogen, how it's produced in the body. The fat cells will produce the estrogen, and so once they start taking the estrogen, that'll make a huge difference in weight loss. So the fat cells, body doesn't have to produce more fat cells or increase the size of the fat cells, and then people lose weight. So that's estrogen. We talked about symptoms. We talked a little bit about treatment. And then we'll talk more about progesterone, testosterone, more about bioidenticals. So I hope this was helpful for you. I hope everybody has a wonderful Friday, a wonderful weekend. If you want to read more about this, check it out in my books. And we're excited to get back with you and to help you on your path to healing. So thanks for watching. If you like it and you learned something, give it a thumbs up. Share it with people who may be helped by this video. And have a wonderful day.